Welcome, my dears, for a new lecture in the PSW. Just now we'll share the screen. Right away, we'll share the screen. Here we go. And we will just go for the new topic on the personal support worker. A new topic on the personal support worker. One of the topics which we want to talk about in the personal support workers is the duties and responsibilities. Like here, duties and responsibilities of personal support worker. The duties and responsibility of the personal support worker. So, likewise, I just want to say, duties of the personal support worker is like we see here right now. I just want to say normal outline view is here. Let us see the outline view. That will be better. I don't think that will be better. So we'll get to the normal back. So that will be fine. And also we'll increase the size of the this thing. So that will be okay. Okay. So here, when we go, the personal support worker's job is full of things which is very important, full of duties, which is very important for him to do his job. As you see, he's caring, he take care of the patients. One of those jobs, like as example, help in mobiling. Help in mobile means help in movement of the patients, like as example, taking him from the chair into the bed and taking him back from the bed into the chair as well. So in those two cases, the personal support worker is just helping the patients or the clients. This is one of the things, and it shows also a kind of passionate, a good communication between both of them, and it shows in the same time a kind of like checking out whenever he's doing the personal support worker, she or he's doing his job. She's checking out the recording any changes in the patient's situation, and it changes and recording his current status, and then if something happened, something is not normal or whatever. The role of personal support worker is diverse. It's too much, but the main objective of their work is to support the health and wellness of individuals in need. So they are there to help the people who are in need. So they are there to help whoever in need or whoever in need to help. They are there to help him as well. That is for the personal support workers job, and we'll go move forward into the next on the next slide here. We'll go to the next slide. Just a sec. Here we go. So by the next slide, we will see here the DPS and what do we mean by the DPS. So DPS, DIPPS, which means dignity for D, dignity, I for independence, I for the independence here, and P for privacy, means that you respect the privacy of your PSW, of your client, you keep the privacy of him. And the second D is for preferences, and S for the safety of your client. So these are the main aspects which we talk about, the main aspects of the PSW. What is the job of the PSW? It's summing up in all these five things. D for dignity, I, independence, P for privacy, and the other P for preferences. And the final one, S, is for the safety of your client. Here, we are talking about the PSW and the rule of the PSW. So the PSW rule encompasses both practical care. So I have practical care and tasks and the provision of compassionate support. So it's not only I'm here also for compassionate support. So I'm giving a practical. Practical means, like as example, bed cleaning or bed making, affording the foods in time, uh, helping in moving the client from the chair into the bed and from the bed into the chair, or assisting in walking, assisting in therapy. All these works is also practical works. And compassionate because the most one who has a very long contact, nurses don't have too much time to spend with the client, but or with the patient. But most of the times, the one who's stuck to the patient always is the PSW or the personal support worker, with the ultimate goals of providing holistic care and enhancing the well of the clients. So this is another point. We'll go to the next one. Once we are here, we will talk about the primary responsibility. The primary responsibility of the PSW includes assisting with activities of daily living, which we call it ADL, activities of daily living. As example, the grooming, bathing, showering, shaving for men, moving them from the chairs into the bed and from the bed into the chair. Like here we say bathing, dressing, helping them for dressing and grooming, mobility, and offering emotional support. Like as example, you have to be very good communicator with your client. You have also to be listening attentively to the client's needs. Try to be compassionate with him. Like as example, help him like exactly you make him like you're touching him. You feel him like by other meaning so that you succeed in this job. So here we will go now to the 6 responsibilities of the PSW. The first one of them, at the heart of these responsibilities, is the personal care. It comes the personal care assistance to the clients. This encompasses bathing, grooming, dressing, and assisting with mobility. We said this before, and we are repeating them back. Bathing, grooming, dressing, assisting with mobility, like what you see in front of you here. Oh, these are the things which a PSW should focus about, and these are the heart of the work of the PSW. At the same time also, and focus on preserving the dignity and independence. Don't show them or don't show your clients that they are weak or that you are doing them a big favor or big thing, that you are doing a heroic work. No, make them feel proud of themselves, make them feel that they have a dignity and they are independence. Don't show them that they are in need to you. This is the most point, very important here. One thing more also, have a good connection with your clients. So this piece parts in the yellow is very important in this page. So the assistance again with bathing, grooming, dressing, assisting, and mobility. Preserving the dignity and independence means your clients to keep them proud of themselves and feeling independence, and don't make them feel that they totally depend on you, and without you, don't make them feel that you are the one who's there for them, and that's without you, they won't be able to, without a PSW, without you as a PSW, they won't be able to complete life and so on. Also, have a good connection with them, be a very good communicator, and to contribute to overall well-being of their clients. So always be there to help them to be for their well-being. The second thing is emotional support. So the second duty, we said we have 6 duties or responsibilities for the PSW. The second one is emotional support. The emotional support rule involves providing emotional support to these clients. This involves listening attentively to them, to their needs, and to their emotional needs, to the reflection about what's happening around them, and offering compassionate and support to your clients. As a PSW, you should offer companionship and compassionate as well, and give them support as well. Being a vital source of comfort for them also. So you have to provide them emotional support and being a vital source of comfort for your clients. The clients, especially for those facing health challenges or coping with the effect of aging. As example, those who has cancer and they are facing distress, a big stress as well. They're oppressed. They feel like that they are like in a panic situation. So just give them a hand, give them emotional support. Give them emotional support. Okay. Also, should build a trust. As a PSW, you should build a trust and fostering a caring relationship with your clients. You should make always your clients give them compassionate, give them passion, give them love, give them care. Those are the key components of the emotional support for the PSW and his role in this. Yes, for the medication management or the third main duties of the personal support workers duties is the medication management. In the medication management, yes, the PSW do not administer the medication. He doesn't give prescriptions, he doesn't, but he's there to remind the client with his own medication types. He's trained to assist and prompt their clients with medication management. This includes ensuring that the clients take the correct dosage at the right time and the date. So, as example, I have 4 types of medication. This time is 1 o'clock in the afternoon. This is 6 o'clock in the morning. So I know every kind. As example, the cholesterol at the morning, as example, or between after lunch, and the blood pressure is in the morning. The tablets of the blood pressure, what are the contents? Like 5 milligrams or whatever. So he know very well. The PSW, he or she knows very well time management and the prescriptions, when to give their clients the medication, or we call it the medication management, when to give them the medications. She knows very well the dose. She reminds the client with his medication like schedules or the times of his medications. Attention to details and adherence to prescribed protocols are essential to maintaining the health and safety of their care. And this is another point. So the third thing we said today is the medication management. Let me go back with you to what we had before. We talk about personal care assistance, and in that we said the bathing, grooming, dressing, and helping them in everyday life situation. Then we move into the emotional support. We said to be compassionate with them and provide them emotional support and being a vital source of comfort to your clients. The third thing, and also build a trust and fostering a caring relationship. Show them that you care about them. Show the clients that you care about them. Then the third job is the medication management. And we said here that the PSW are trained for the medication management and ensure that they take their medicines in time and so on. We'll go next into the next slide. Assistant, the ADL. This we call it ADL. Usually it's written like this, ADL, or daily life activities. Activities of daily life. So they are like what? Meal preparation, light housekeeping, as example, like bed making and so on. The laundry, their own laundry as well, and support with mobility. So support them. Mobility means the movement of your client. As example, help him to just, if he want to lean on you, like to go to the washroom or to, then you will give him his cane and you will help him to move. Or if it is like supporting them to move from the wheelchair to the bed and from the bed into the wheelchair as well. By addressing these tasks, the PSW create conductive and comfortable living environment for their clients. The fifth job or duty of the PSW duties is advocacy and communication. He must communicate with his client. He must know how to communicate with them, feel his client needs, know what his client wishes, and so on. Because a PSW is a bridge between the client and the broader healthcare system. The broader healthcare system is including the nurses, the doctors, the staff who's working in the hospitals, or whoever is supervising the healthcare, or professional like the family doctors and so on. So here the PSW is a bridge between the client, means the patient, the client means the patient, and the broader healthcare system. So he's in between them, between the client and the healthcare system. PSW communicates the needs and preferences of their clients to the healthcare. So the PSW is responsible about to know from the client, to know from the client what does the client want, then conduct this and report it into the healthcare system, whether it's the nurse or the doctor or whoever. So, but actually, usually the direct relationship is between the PSW and between the nurse directly. In that aspect, it's between the nurse and the healthcare. Advocacy also involves empowering clients to express their references and actively participate in decisions. Also, to make them, encourage them to participate in their decision, to say their opinions, say their right, and so on. Also, one of the main duties of the personal support worker is the continuous professional development, which means that the client is, or the PSW is always improving himself, updating the knowledge in himself, in this industry especially. He should know every new about his job. Things come to the pop up to the surface, and things are now newly, and he did not know before. So he must know everything about the industry as a PSW, as a personal support worker, and update his knowledge as well. PSW embrace the responsibility of continuous learning and professional development to stay abreast of industry advancement. Okay. So the PSW is required to update his skills and knowledge. He's required to update his skills and knowledge, always in that point. This is about the PSW and what he should do. Also, we can talk at what we said before about the verse of the duties of the PSW. We can move into it as well. So we can say it from another angle or from another angle of another aspect, that the personal care and assistance, which we said before, like bathing, grooming, dressing, these jobs, which is very important as well. So these are the jobs which usually is done by the PSW, the bathing, to help the client or the patient into bed, grooming and dressing and so on. Also, the second thing, nutritional support and medication management. We said this before. He helped him also because he's administered the meals and he know what this client wants. Does not need beef or fish or chicken or whatever. So he's the one who know, and he reports this to the management. Ensuring clients receives proper nutrition. PSW manages meal preparation and feeding as well. So he make sure of the meal preparation and feeding and adapting meals to meet specific dietary needs and preferences, especially dietary because you have many patients, many patients who are diabetic or whatever, and they go on a diet. So the PSW must know everything about them. We'll go after this into, as mentioned previously, like we said before, he does not administer medication, but they play a vital role in the medication reminder. They remind the clients with the times of their own medication. They help the clients maintain their health and wellness always. Also, the PSW is helping in the point of mobility and physical health. He's helping the clients also to move. He's helping the clients to move, like I said before, like uh, go to the washroom or just go for a walk, or help him in his therapy, help him to move from the washroom into his bed, help him to move from the chair, the wheelchair, into the bed, and from the bed into the wheelchair. These are all the works. Also, mobility supports involves assisting clients with movement, but it's aiding in walking, means help them to walk, transferring them from the bed to the chair and vice versa, or facilitating prescribed exercises also. So as example, I was working in hospitals, and usually the doctor tell me do this with them, or the physiotherapist tell me do this point, take them for a walk for 15 minutes, and so on, or just walk by this way, or walk from here till the end of the room. And also we use always to be standing beside them to support them in case of to avoid that they fail. The mobility support is crucial for preventing falls, maintaining muscle strength, and enhancing mobility, contributing significantly to the physical well-being of the client as well. Also, the exercising the physical therapy assistants, they consider like they are assisting the physiotherapy system in a clinic or in a hospital or whatever. So also the PSW is there to assist the clients with exercise prescribed by healthcare professionals. The rehabilitation also is one of the points which the PSW can help in. So in that case, they prevent further decline in functions. Like as example, doing the stretching to more structured exercise routine, depending on the client's conditions and capabilities, and what is the aim of the program of the client should be taken, the goals of the program should be given to the client, providing motivations and physical supports as well. The PSW help clients achieve the mobility goals, contributing significantly to their overall well-being and independence. This is the emotional. We said the emotional support is very important also, and the psychological support. Psychological, because some, like as example, those with ambulation cases or with cancer, so they need emotional support. They need emotional support. Also in the fields of mental health as well, and so on. And the feeling of loneliness, they can help in this as well. Ensure the clients feel valued and connected, and help him to keep on his own self-esteem as well. Emotional and psychological support is a key component of the holistic care provided by the PSW, recognizing that health components, both physical and mental well-being, PSWs offer support, companionship, and listening ear to clients, dealing with emotional distress. So I always show the interest in listening to my client. As a PSW, I have to show my interest in listening into the client. Loneliness or psychological impact of illness and aging. Of course, this type of support can improve the client's mental health, enhance their quality of life, and provide a sense of belonging and connections. The PSWs are always trained to observe signs of emotional distress. So he will know if his client or his patient is in distress or is having a hard time or no. Any PSW must be trained and experienced in knowing this. Then he has to provide appropriate intervention or referrals, highlighting the importance of the role in addressing the emotional and psychological needs of the clients. They must give the clients the psychological needs to satisfy their psychological needs. Home care and environment management also. PSW are responsible for light housekeeping, like we said before, maintaining clean and safe living environment. That's part also. This includes like such as cleaning, doing laundry, and ensuring the home is free of any hazards or risk that might. Hazard here means risk or reasons of risk, which leads into losses. So as example, he must make sure that the ground is not wet and so that no slippery and that the washroom is safe. There's no water on the bottom on the ground in the washroom. You must make sure also that lights are enough for the client to see clearly so that they will not fall. They will not fall anywhere and so on, which is essentials also for overall the well-being and the comfort of the client. Welfare and safety assurances. This is one part of the clients of the PSW's duties. The family and friends of the clients trust the PSW because he's the one who's always with the patient, with the safety of their loved one. Usually, like the family, trust so much the person who is in a long contact with their client. Personal support workers are expected to follow health and safety standards and to be aware of hazards and or dangers that may compromise the health and safety of the client. So they must keep them always safe. They must keep the clients safe. Finally, one of the most important jobs of the PSW is to record. Is considered like he's recording. Recording means what? As example, if I'm working in a hospital and they tell me the intakes and the outtakes of the patient. As example, how far he drink water. Did he drink 2 bottles of water or did he drink how far? So how many liters or half liter or 1 liter he drink? And how about the urinate? How much the amount of urine he got, so I can know from the catheter as example, or how far he got like as example, so that we see if there is anything retained in the kidney without exit as urine or no. So as example, if the intakes was 300 millimeters and the outtakes was only 50 millimeters, that means 250 are not yet out. So that can be a sign that the patient is not well and part of his own urine retain in the system without getting out. So in that case, action should be taken. PSW are required to keep detailed records also for the foods, what time they take food, what time they eat, what time, and just to register all these points each day and report any changes in the demeanor or mobility to their coworkers. Also, at the end of the shift, when I'm doing any shift as a PSW, I have to provide a summary, and this summary is considered like a record. It's like this summary is like a record to the next colleague. On the next shift, I have to tell him about what's happening to the client. That was today's work And then we will say here the question of this lecture, discuss the rule, duties, the rules, duties also, duties, and responsibilities of a personal support worker, a personal or PSW. Discuss the rules, duties, and responsibilities of the PSW, and that was including all the points which we talk about today. I shall wait here for a few minutes to get your answer about this question, which is the most important question today for this lecture. Discuss the rules and duties, duties and responsibilities of the PSW. We'll wait here for a few minutes to get your answer, guys, based on what we had today in this lecture. Thank you so much.